malnutrition may come in the form of undernutrition or overnutrition. When you think about children living in poverty in America, what type of malnutrition do you think they experience the most? Many children living in poverty in the United States suffer from malnutrition due to hunger and food insecurity. Poverty is the root of food insecurity in the United States. Food insecure households tend to purchase cheaper foods filled with high fats, sugars, and refined carbohydrates, leading to overnutrition in children. Here is a list of a few of the health effects children face due to hunger and food insecurity. For the sake of this project, we have decided to place a focus on obesity, considering it is most prevalent in the United States. Several empirical research studies have been conducted and have linked poverty to a higher risk for obesity. Here are a few studies we have found that directly link poverty to obesity in young children. Let's look at a few maps and graphs comparing poverty to obesity rates in the United States. Let's look at a list of policy that has been developed throughout U.S. history in order to address food insecurity. Early food stamp programs, national school lunch programs, the expansion of the food stamp program, better known as SNAP, implementation of school breakfast programs, free and reduced priced meals at school, supplemental nutrition programs for women, infants, and children, better known as WIC, child and adult care food programs, and summer meals for children to provide meals to children in food insecure households over the summertime. part of Michelle Obama's Let's Move initiative includes the Hunger Free Kids Act of 2010. This act, quote, simplifies management of the National School Lunch Program, expands access to the school lunch program, improves nutritional quality of food served in schools, and strengthens school wellness policies by promoting nutrition, education, and physical activity in an attempt to combat childhood obesity.
Right now, there are 23.5 million Americans, including 6.5 million children, who live in what we call food deserts, in the inner city and in rural communities.
Lots of different definitions of food deserts, but most people basically say it's a place where there is not access, easy access, affordable access, reasonable access to fresh fruit, vegetables to a grocery store.
You see a preponderance, for example, of convenience stores and fast food restaurants, but very little healthy food options for those residents.
We are at the Fairhill Elementary School in Philadelphia. We're focused on a tremendous program that they have here to reduce childhood obesity in this school and also to encourage fresh food and healthy eating.
Our goal is ambitious. It's to eliminate food deserts in America completely in 7 years. Tackling the issue of accessibility and affordability is key to achieving the overall goal of solving childhood obesity in this generation. And we saw this example today during our visit to the Fresh Grocer at Progress Plaza. The last supermarket that was in that community closed more than 10 years ago. There were kids in that community who couldn't get the nutritious food that they needed during some of the most formative years of their lives. This is happening all across the country. We're setting people up for failure if we don't fix this. With a modest initial investment of about $400 million a year, we're going to use that money to leverage hundreds of millions of more from private and nonprofit sectors to bring grocery stores and other healthy food retailers to underserved communities all across this country. If you can do it here, we can do it around the country. So let's move. That's really the point. If we know it can be done, let's move, let's get it done. Let's give our kids everything they need and everything they deserve to be the best that they can be. Thank you so much.
So, did you hear her say it? Miss Michelle Obama stated that tackling the issue of accessibility and affordability is the key to achieving the overall goal of solving childhood obesity. Our first implication for social work practice was researched in the Child and Adolescent Social Work Journal. The author, Sean Lawrence, suggests that social workers address the negative consequences of stigmatization due to appearance in children facing obesity. On page 315, Lawrence suggests that social workers need to not only address strategies for behavior changes to reduce obesity in school children, but also need to develop ecological programs targeting parents, peers, school officials, and society. He also suggests social workers should develop interventions aimed at reducing stigmatization school-wide.
Currently, social workers do not have any practices that combat childhood obesity. In the article Understanding and Acting on the Growing Childhood and Adolescent Weight Crisis, A Role for Social Workers communicates that social workers are not included in the planning of ways to eliminate childhood obesity. This article informs us that even though social workers are not included in the planning of reducing childhood obesity, it is still imperative for us to get involved. On page 149 of the article, the authors discuss that our programs to decrease childhood obesity are at the meso and macro level, making them reactive instead of proactive. We need interventions that start at the micro level to prevent childhood obesity versus fighting it. Furthermore, the language doctors use when informing a patient that they are obese or overweight tends to be restrictive language, eliminating foods out of their diet. They generally tell them all the foods they should avoid and not eat. On page 150, the article states that research indicates that controlling food intake corresponds to the increased intake when the children were given unlimited access to the foods that are restricted at home. Additionally, this is where social workers can play a vital role in decreasing the amount of children remaining obese. Social workers should encourage healthcare professionals to educate their patient on how to make healthier lifestyle choices. This approach educates the client but also empowers the client by giving them the tools they need to become healthier. Social workers should also assist in educating the clients by providing them with resources and teaching parents how to navigate the grocery store to purchase healthier foods. This article also touches on the stigmatization of obese children. As social workers, we need the community to realize that we are vital assets in the health of our children and should take action in reducing the amount of children who become obese.
As a social work practice recommendation, we plan to develop a community program aimed at increasing the accessibility of SNAP and WIC benefits to families in need. As social workers, we can help eligible, non-receiving families by removing burdensome participation requirements such as paper documentation requirements, communication barriers, lack of internet access, and transportation barriers. Program workers will provide patience and offer cultural competence skills when working with clients. Program workers will have the skills needed to explain the details of the application processes, the renewal processes, and the ongoing requirements. This program will be located at convenient community locations such as schools, churches, libraries, and recreation centers. Local schools and districts at risk for food insecurity will provide flyers to students for them to take home in their weekly folders to inform parents of the program details. Parents will have the opportunity to consent to the program and receive informational packets with straightforward instructions, provisions of services, and requirements for the state program eligibility. With proper funding, the program can provide adequate transportation to DFACS offices, local health centers, Social Security, immigration, and vital record offices on a monthly basis. This community program will consistently provide services to communities at risk for food insecurity in order to provide sufficient services to families in need of SNAP and WIC benefits. This map illustrates the percentage of each country's population suffering from undernourishment. The orange, red, and maroon countries have the highest percentage of undernourishment, whereas the dark green countries suffer from no undernourishment. There has been some global policy developed to addressing malnutrition on a global level. In Africa, for instance, donors are funding to help alleviate Africa's nutrition. Some of the donors include the U.S., with President Barack Obama's 2009 Food Security Initiative for Africa. Social workers can collaborate with the following organizations in order to address global malnutrition.
Worldwide, more than 220 million children suffer from malnutrition. 18 million of these children have severe acute malnutrition. Malnutrition can reduce a child's physical growth, brain development, and learning ability. The effects may be irreversible. But you too can have a tremendous effect on the life of a child. Adhesia, a local nonprofit with a global impact, manufactures Plumpy Nut, a vitamin-packed peanut butter blend engineered to fight childhood malnutrition around the world. In an average time span of 7 weeks, Plumpy Nut can help a malnourished child attain a healthy weight. Adhesia reaches about 800,000 malnourished children annually, and we can do so much more for them with your help. And all it takes is $5. Donate $5 by this St. Patrick's Day and challenge 10 friends to do the same for a total of $55, the cost of 1 box of Plumpy Nut, a full life-saving treatment. 1 box, 1 life. This year, make your green count.
Hi, I'm Janet Jackson, and I want to speak to you about something that truly is a matter of life and death. Right now, children in the Sahel region of West and Central Africa are at risk of dying from severe malnutrition. UNICEF is working tirelessly to provide therapeutic feeding, health care, and clean water. But to reach every malnourished child, we need your help. You and I know it's unacceptable for any child to die from hunger in the 21st century. I believe in a world where 0 children die from malnutrition, a world where 0 children die from things we can easily prevent. With your help, we can save lives.
Here are a few things we can do in our communities to address poverty, food insecurity, and obesity. We can do things like send veggie trucks into low-income communities. We can promote more double food stamp initiatives for buying fruits and vegetables. We can continue to update the nutritional standards for foods, snacks, and beverages in schools. Apply the shared use of school and community recreational facilities because they are a cost-effective way to promote physical activity in the community. And also advocate for healthy food and drink availability in all community stores, especially in low-income communities. The state of Georgia has created more community awareness by designing commercials aimed at fighting childhood obesity. Here are a couple examples of the commercials that have been put into place.
Playing video games is what I like to do by myself. I don't have to be around the other kids. So all they want to do is pick on me.